that includes salaries, allowances, and poor facilities, rather. This as COVID-19 numbers surge in the country. For more on this, I'm joined now by the president of the Nigerian Association of Resident Doctors, Dr. Uyilawal Okhuaihesuyi. Dr. Uyilawal, good evening, and thank you very much for your time tonight here on In Focus. What are the grievances amongst the doctors in Nigeria in this time of COVID-19?
Good evening. I'm Dr. Uyilawal Okhuaihesuyi, president of the Nigerian Association of Resident Doctors. We gave an ultimatum to the Nigerian government on the 31st of January with regards to the problems we're having with the welfare of our members. As of January then, when we gave them an ultimatum, we have lost about 18 resident doctors to COVID-19 and without a death in service insurance. And this was part of what we asked the federal government to provide basic insurance, health insurance for all health workers. And it's about 18 months now since then, and no member of the 19 members that died, lost to COVID-19, have had any death in service insurance. We had members under the non-regular payment platform, which we call the gift mix. About 10 institutions that were employed on that non-regular platform that were being owed 7 months' salaries, and they have not been captured into the IPs, which is the regular platform of payment in the federal institutions. We have state governments like Abia State that owe resident doctors 19 months of salary. We have Imo State that is owing them 8 months of salary. We have Ekiti State that owes 2 months of salary, and Ondo State that owes 4 months of salaries. We have also the interns, which are the younger doctors that just started practice, their 1 year compulsory practice, that are supposed to be under this scheme of service. We got a letter from the head of service, removing them from the scheme of service. Means they won't be entitled to getting salaries, but rather be given allowances. We have also, for the members under the residency that have been paid medical resident training fund. Yeah. And up to now, we don't only paid for 2020, 2021. So these are part of why we have strike.
It's a number of challenges there that you're mentioning. I mean, from health insurance to owed salaries and interns that are just not getting paid. What would you say is the underlying cause for all these discrepancies? Is it just a question of no funds?
It's actually not that. It's having responsible leadership in the health sector. First, we start with the budget. The budget for Nigerian health sector is about 3.7% to 4% of the budget, which is not enough in other clients. We also know that if you have serious-minded people, we shouldn't be going on the strike after 115 days when we sign the memorandum of action. That shows that somebody's not doing his or her own job. These are reasons why people are having strikes over and over and over again when some people are not staying and doing their jobs. And there's no punishment for those that err. You can imagine with the COVID-19, we have other infectious diseases like Lassa fever, HIV, and co that have killed members. And for us just to be paid 5,000 naira as the hazard allowance, which have been on since 1991 and have not been reviewed. These are failures in systems, and there have to be consequences. Yeah. So our going on strike again is not because we are eager and not patriotic and don't want to see patients. It's about people not doing their job.
Right. And how long will this strike continue?
We have signed memorandum of actions 115 days ago. We called off the strike because of what the feelings we have for the nation and the patients that are suffering. Although we have the consultant that's still working, so till we are called back, shelve and be on a strike. It will be actually bring the attention of the government to pay more attention to the health sector. But you can't imagine when of the 6 zones in the country, you don't have a standard hospital where you have MRI, CT scans, the basic things you need to see a patient. That is why most of the rich men down here in the country travel out to seek for better health care. where they cannot develop theirs in their own country? These are big questions that the government needs to answer.
Dr. Uyilawal Okhuaihesuyi, I appreciate your time. Thank you very much for joining us tonight. President of the Nigerian Association of Resident Doctors. We're going to strike there indefinitely until government pays attention to the plight of healthcare workers.